an hour-long talk last year at the APNA National Conference done by Pam Green, who you can listen to get a sort of the history as why these were developed and how they were developed. So we're going to talk about the competency number 4. And what we're finding in doing our pilot training and trainings, we've done about 4 or 5, is that people are having some difficulty with distinguishing between warning signs and risk factors. And this has to do with the competency number 4, which is the psychiatric nurse generalist collects the accurate assessments information. And so I think it's important. This is interesting with the ER, with the ED, and kind of how to determine whether really somebody needs to be admitted or maybe increase the support system, et cetera, those protective factors, and then discharge them. So it'd be interesting to, when we do the case study, to look at the differences between the risk factors and the warning signs. Okay, so we're going to just describe the difference between the two, and then in the case study identify those warning signs. Okay? So as you know, a suicide assessment or suicide is actually very, very multidimensional. There is not maybe one thing that happens, or one, we can't pinpoint exactly maybe why someone did suicide. It's complicated, I think, it's multifaceted, and just to be aware of that it does take a comprehensive assessment to make that dynamic formulate a risk. Okay, and so the differences between the risk factors and the warning signs are right here. I think what we want to say is that the risk factors are maybe more long-standing. They are over a longer period of time, and maybe not that they're not really changing. For example, maybe a risk factor could be something that a parent dying of suicide. Okay, that's a risk factor. A warning sign is something that you identify in your gut. You say, oh my, it's that sympathetic response where, oh my gosh, I'm looking at this person's journal and they're writing about it. There's drawing pictures of it. They're taking action. They're collecting pills. They went to go buy a gun. Okay, so those are sort of, they're more hopeless. And what we find is that the risk factors and the warning signs, sometimes they're together or they're the same. Like hopelessness can be a risk factor and it can be a warning sign. Okay, so that's something we have to be aware of as well. So the risk factors for suicide, a previous suicide attempt, unemployment, divorce, separated, relationship issues, social isolation, of course a psychiatric diagnosis, chronic debilitating physical problem, especially ones that are dealing with pain, terminal illness. So we want to make sure that we're having a dialogue with this person. And it needs to be a dialogue in the context that it's a caring conversation. And developing that relationship and rapport with somebody. And think about what is it that actually, what is the ideation? What are they thinking? What is the thought content? What are they saying? The presence of suicidal ideation is indicating that, that is a warning sign and it can be a warning sign. The absence of it, when somebody says, no, I'm not thinking of suicide, yes, it isn't necessarily possible. So you have to think about the motivation of why someone is saying what they're saying. And sometimes people with non-suicidal ideation try to get out of the hospital, or try to be in the hospital, and put in the hospital. Also, you want to look at that relationship between the intention to die, thought about dying, and then actually intending to. That has to be assessed. The method. So lethality actually has to do with the time at which it takes to rescue. So it's like a decreased, or in one goes up, one goes down. So if it's the least amount of time to rescue, it increases the lethality. Okay? So maybe taking pills is not as lethal as a gun shooting themselves, because the time to rescue for shooting a gun or jumping is much less time to rescue. So we want to make sure that we're assessing means. And then we want to look and ask if someone is preparing. Have they set giving things away? That's a warning sign. Have they looked at their insurance? Well, what do I have here? Who's my beneficiary? Have they set things up? Do I want to increase my amount? Have they rehearsed? Have they gone to the building? We had a patient who went to she did jump from a tall building, and she actually went there at least 4 or 5 times before she actually did suicide. So we want to ask, do you have a place where you're going to jump, if that's what they're going to do? Okay? Have you been taking pills? Hoarding pills. How many pills do you have in your medicine cabinet? Okay. So this is something that we got from the Canadian guidelines in Ontario, and I think it's a very good way to picture risk factors versus warning signs. And the risk factors are actually on the bottom, like, for example, suicide attempt, a past history of suicide attempt, a history of suicide in the family, unemployment, psychiatric illness, etc. And so as these warning signs at the bottom, the person is at risk, they're still at risk. But as these warning signs, as they go up, like actually threatening to kill themselves, then the risk is imminent. Okay. Seeking means is a very, very, that means they are imminent. Okay, and you have to act on that. You have to protect them. Hopelessness is a risk factor, but it's also a warning sign. So make sure you're monitoring the amount of hopelessness someone is having, and also feeling trapped. And that is sometimes that a situation can make someone feel trapped. And so that can be a warning sign too. Okay, so you have to assess for that. So here's a little bit of a case example. So there's risk factor could be that they're unemployed. But the warning signs is that they're increasingly hopeless, or they're binge drinking. That's another warning sign, when they're engaging in binge drinking or using substances recklessly. Okay. Expressing thoughts that they'd be better off dead. Oftentimes people feel a burden. Oh, don't worry, you don't have to worry about that. I've taken care of it. Okay. Risk factor, divorced, widowed, separated. So any thoughts on warning signs for that?
Feeling unloved, that they're not capable of having.
Okay, feeling unloved, but what about moving towards actual suicide? Giving their things away? Yeah, giving their things away. Maybe isolating more. Okay, so here are some case examples here. A 22-year-old female who voices no longer having reasons for living. Okay, recently unemployed, has a diagnosis of bipolar 1 disorder. B, a 55-year-old male who threatens to end his life every time he binge drinks with his friends. A 65-year-old female who's anxious, has difficulty sleeping, and has chronic pain. A 40-year-old male who expresses a wish to die, withdraws from family, and is hopeless. drives at high speeds on his way home. He tries to decide which tree will be the one he uses to end his life. Okay? So which case scenario is the most imminent, do you think, in terms of risk factors versus warning signs? Okay, D, all right. So let's just go through the risk factors and let's go through the warning signs and see for the first one, what are the risk factors there? She's saying that's a little bit of a warning sign, yeah? What are the unemployed, is that a risk factor or warning sign?
Risk factor.
Risk factor. What about the diagnosis?
Risk factor.
Risk factor, right? Okay. So it means that they're more at risk. They're more at risk, and we have to assess that and be aware of it, okay? But when someone starts to act on it, talk about it, write about it, take action, then those are the warning signs. And that could be the difference too, is then you have to look at the protective factors as well, okay? To determine whether maybe somebody gets hospitalized, and also supervision on the unit, okay? What about the 55-year-old on number B? So we know now that the highest rate is 45, I think, 45, and that 45 to 55 or 65, I think. The highest rate of suicide is that within that age population. What about binge drinking? Give me a warning sign. He threatens to end his life every day. I still would be concerned about that. We need more assessment there. What about the 65-year-old female who's anxious, difficulty sleeping, has chronic pain? Those are warning signs. Those are risk factors, sorry. Okay? But it puts her at higher risk because she has those risk factors. Pardon? Can't hear. It's more of a risk factor. It's more of a risk factor than a warning sign. So let's talk about that. Why would it be more of a risk factor versus a warning sign? It increases her risk, yes. Chronic pain increases risk.
Does she need to know how long she's going to get difficulty sleeping, and has it got to the point where she's at risk to commit suicide?
Well, how many people have difficulty sleeping? Does that mean they're going to kill themselves? Does that indicate they're going to kill themselves? Maybe think of it that way. Insomnia, yes. Chronic pain, yes. Anxiety, yes. Those are risk factors. Those increase someone's risk of making an attempt. Now, let's say if someone has insomnia and hasn't slept for days and starts to think about, what if I going to get pills maybe? Starts to drink. Decides to get a prescription of benzo. Thinks about, well, maybe if I we know a lot of clients that have come to the hospital saying, all I wanted to do was sleep. I didn't want to, this was not a suicide attempt. I just took a lot of pills or benzos or Rustoril, whatever, Dalmane, Xanax or whatever, because I wanted to sleep. And I also drank a bottle of wine. Okay, I didn't mean to kill myself. So insomnia isn't a warning sign, it's just a risk factor. But when you start acting on it, you have to assess what their intention was. That's why it's really important to talk to somebody about what is it that they were thinking. What were the circumstances around their attempt? So the withdrawing from the family is an action, being isolated, the wish to die, the hopelessness, the driving, the recklessness, thinking about which tree to run himself into. Those are warning signs. Okay? Let's get some questions. Have a dialogue. And sometimes it's good, you have cases, you have people that you've worked with that have, how many people that have worked with a client that's died by suicide? Maybe, do you want to come up and talk about that? Sometimes it's good to look at it retrospectively. What were the